before we get on to the COVID committee, I know you're a member of that, and I want to talk to you about some really interesting evidence which was given today before the coronavirus committee. Let's talk about these images, though, that my colleague Andrew Clennell has brought to our viewers today. It's of the Cairns airport and the tour terminal where the boats go out to the reef. It's heartbreaking to see. It's such a beautiful, beautiful city and region. You're the Shadow Minister concerned for that part of the world. You must be hoping that the Palaszczuk government's able to reopen as scheduled the state borders on July the 10th.
Hi, Kieran. Good to be with you. Well, look, I think the most important thing that any of us can do, whether it be in North Queensland or anywhere else in the country, is make sure that we can get the economy up and running again in a safe manner. And I commend Premier Palaszczuk for being cautious about reopening the Queensland border. What we've seen over the last week in Victoria shows that we haven't beaten this virus and that spikes are still possible. In Queensland, we're now entering our 8th day in a row where we haven't had any new cases, which is an incredible achievement. We've seen similar performances from other states that have got closed borders. So I think we do need to be very careful about rushing out and making dramatic changes that could expose our population to greater risk. I mean, the big thing that the Palaszczuk government did recently, which is going to really help our tourism industry, is open up all of Queensland to travel within Queensland. I know I'm going to be taking a holiday in Queensland with my family shortly, and many other people are as well. That will certainly help our tourism industry right up and down the coast and out west as well. But look, all of us would like to see the borders open as soon as that can be done safely. But that's the key word. It's got to be done when it's safe to do so.
Now, let's look at the hearing today. A number of medical professionals appeared before the COVID committee. There was one takeout which was really concerning when I had a look at it, that COVID-19 might not actually be the big one that we face in our lifetime. That's hard to fathom.
Yeah, look, that was very concerning evidence that we got today, that we do live in a world where these types of pandemics do look like they might be becoming more common. And that's exactly why we think that we do need to have greater planning for these kind of events into the future. I mean, it was interesting that we had evidence today from some of our peak medical and health bodies, groups like the AMA and the Nurses and Midwives Association, who were saying that we do need some kind of centre for disease control, as we see in most other advanced countries. Interestingly, that's something that Anthony Albanese called for yesterday in his speech at the National Press Club. I think what became clear today in the evidence is that really Australia dodged a bullet when it came to the coronavirus. We didn't have the stockpile of protective equipment in place that we needed, and there were a range of other measures that weren't in place, and we sort of scrambled around, got them together organised, and fortunately things have worked out well. But I don't think in this day and age it is acceptable for us to not have regular pandemic planning, and that's exactly why we need a Centre for Disease Control established, and that's what the AMA and the ANMF were saying today.
Was there some discussion as well about the prospect of a CDC, a Centre for Disease Control, that might have an oversight across not just Australia but our neighbours as well? Because obviously the regional focus is an important one as well when we're talking about a pandemic.
For sure. I think there's definitely scope for any Australian CDC to have that kind of global or regional outreach. This isn't something that's confined to Australia, and we know that some of our near neighbours are really struggling with the coronavirus right now. So I think that there would be a strong case for an Australian CDC to work in partnership with other countries in our region. But the first step is actually to see one established in Australia, and I certainly hope that the government will act on the calls, first from Anthony Albanese, but now from some of our peak medical organisations as well.
So in terms of the logistics, how would that complement the health department? Because we've seen, obviously, Brendan Murphy, Paul Kelly, Nick Coatsworth, these, they've played a really important role via the health department in terms of providing clear information to the public. How would a CDC work in conjunction with those health bureaucrats?
Yeah, well, there's different models that you could come up with for establishing a CDC. If you look at the United States, they have a highly centralised model. If you look at some of the European countries, they have more of a networked model that works with federal governments, state governments, local governments, medical institutes. There's a range of different ways you could put it together, and we'd certainly be open to discussions with the government about how that be set up. I think the key difference, though, compared to what we've got in place at the moment, is that this would be a standing, independent organisation that could be providing advice to government and, frankly, keeping a bit of a watch on governments. I don't think it's a good thing that we got to a point that we didn't have the national stockpile of personal protective equipment, masks, gowns, those kinds of things in place, especially, as you say, if it looks like we're going to be facing these kind of pandemics in the future. So there's a range of ways you can put it together. The important point is to actually establish one, and that can work right hand in hand with our state and territory organisations as well.
Senator Watt, you obviously would have discussed at length this spike in Victoria. What went wrong, according to the experts that the committee heard from?
Well, the evidence we had today is pretty consistent with what you've been hearing in recent days. It does seem that what's happened in Victoria is that, unfortunately, people haven't been listening to the guidance from health authorities and from our political leaders that this virus hasn't been beaten, and we still do need to be really careful about things like social distancing. It seems pretty clear that some families and groups of friends were gathering in larger numbers than had been recommended, and the virus has been transmitted out that way. So, you know, you just can't make the point clearly enough that people have got to listen to the health advice. You know, Victoria does seem like they're doing a pretty good job of getting on top of this now. We're really ramping up their testing and involving the Defence Forces as well. But one clear message that came through today is that this is not something that we've beaten. We've got on top of it as a country, but it has the capacity to come back very quickly. So it's really vital that all Australians do listen to that health advice right now and into the future.
Senator Murray Watt, appreciate it. Thanks.
Good to talk, Kieran.